Hello, I'm Mary Rockwood Lane. I'm an associate professor at the University of Florida. And I welcome you to this time that we're going to spend together on caring and healing arts. I'd like you to put everything to one side so you can allow yourself to be present to this presentation. So if you could just take a deep breath, allowing yourself to be centered, allowing yourself to put everything that you've been doing before this time to one side so you can focus and be present and be able to give this time to yourself. Take a deep breath, allowing yourself to relax, feeling your awareness going from ordinary awareness to an extraordinary awareness, to where you can receive and be present in this moment. Allowing yourself to relax all the way down to your belly, to the wider and deeper part of yourself. The important part of this presentation is for you to open your heart, allowing yourself to receive this information. So I'd like you to focus on the area around your heart and feel the area, something that you deeply appreciate, something that you love, feeling this energy inside yourself. Relaxing into the gratitude. Now allowing yourself to expand this feeling, allowing it to go all the way through your body, feeling this appreciation and this love. This is based on heart math training and tapping into the heart's ability to be coherent. Now expand this energy outside your body, around the room. Feel yourself, your environment, and anyone else in the room, allowing yourself to settle in. So thank you. I'm going to talk about transpersonal nursing and the ontological artist within our practice, and how healing arts and caring science are deeply related. I also want you to experience that we are part of the ethic of belonging. Nursing has a moral ethical philosophy of caring, which involves not only caring for ourselves, but also caring for each other and caring for our patients and our families and the earth. The other thing I'd like to talk about in this session is how we can reclaim the artistry of nursing and reclaim art interventions, be it guided imagery, music, movement, poetry, visual arts as part of our practice. These healing arts can be part of the integrative approach we have for ourselves, for our patients, and our family, and our colleagues. How can we reclaim the healing arts as part of advanced nursing therapeutics? I want to talk about Dr. Jean Watson's work in caring science because she provides a philosophical and theoretical foundation to integrate the arts into our nursing practice. The caring practice is very powerful because it allows us to deepen our relationship with our own consciousness. Our consciousness of caring is primary. And when we are able to activate a caring consciousness, we can begin to work with ourselves and our patients more effectively. I'd like to review the Caritas Processes. The first Caritas Processes is the practice of loving kindness. When we introduce the arts into practice, we're introducing the arts as a way in which we can honor the resources that we have within ourselves. We release the inner critic. We walk with ourselves from a place of love and a place of kindness, is that we accept ourselves who we are, allowing our creativity to emerge. The next Caritas process is authentic presence. This is a very powerful Caritas process because what I believe, when we use the creative wellspring within us and we tap into our creativity, we are tapping into our authentic selves. We are present to ourselves. We can witness ourselves. We can be present and giving to each other. And this is a very powerful ability for us to practice, how we present ourselves in the world, how we present ourselves with each other. And when we use arts as a way of sharing ourselves, It's truly authentic. The next Caritas process is very powerful. Dr. Watson talks about using our spiritual process of our own lives as a way to develop ourselves and honoring the spiritual orientation of others. And what I found in using arts in healing, that when we use the creative process, it allows us to express the deepest part of ourselves, which is connected to our spirit. And I'll talk about that a little bit later in the presentation. The next Caritas process is creating helping and trusting relationships. And when we share ourselves truly with others, what I discovered when we integrate the arts into clinical practice, not only are we using art as a way of healing, but we are using art as a way of caring. The fifth Caritas process is allowing for the expression of positive and negative feelings. And that's one of the great things about creativity, is when we're allowed to express. When I first started using art in my life, I had gone through a very severe depression. I was very hurt and angry when I discovered art as a way of healing. And I realized that when I was able to express my fear, my despair, and my suffering through my art, I was able to see it. So art allowed me, in a very safe way, to express the negativity that I was having in my life at that time when I was in such a challenging and stressful situation. And many times in healthcare, people are in challenging, stressful situations. And it's really important that we allow them to share their life story, share their true feelings, and share their both positive and their negative experiences. And many times they can express this through the arts. The next Caritas process is creating positive solutions. It used to be more focused on solving problems, but I think one of the most important things when we use our creativity, we can create positive solutions for ourselves and patients. And we allow the patient to express and tap into their inner resources, just like you can tap into your own inner resources when you practice your own artistry and your own creativity. The next Caritas process is teaching and learning and how we develop a coaching relationship. And I feel when artists share, when we share our artistry with each other, we are sharing with each other on an equal level. We're using our own personal experience as a way of understanding each other. And this is critical and important. And we're tapping into what the patient wants for themselves, or the artist wants. We allow them to be honest with each other, and we reflect back what it is they want to accomplish for their healing and their health care. Then the next Caritas process is how do we create healing environments? And this is really founded on Nightingale's work, and she talks about it extensively in Notes on Nursing, where we put the patient in the best environment that they can have so the healing process can take place. Nightingale also talks about how it is important to bring in light, to bring in beauty, to bring in the outside so patients have a view of the outside, and how important it is for people to be able to see something beautiful. She notes in her Notes on Nursing, she talks about how powerful just bringing in flowers, the brightness of those colors, can have an effect on our patient's well-being. This is very important. The other Caritas process is really providing for the patient's physical needs with dignity. And this is so important, that we provide for our patients and honor their dignity and honor whatever expressions they have for us. And then the other part is how do we recognize and honor the mystery that's within each human being. And that's where art and healing come in. Because the power of healing is so powerful that when patients and families use art, they sometimes go to a place inside themselves where they move through their experience into themselves, and it's really a process of healing from within. healing from within. And many times, what I did when I was doing my dissertation and I was doing my research on my doctoral studies, I was researching the experience of healing with the arts. I asked people who identified that art was healing for them, what was it about your experience of using art that was healing? I did a hermeneutic qualitative study. I asked people what their lived experience of using art as a way of healing. And it was very powerful. I listened to stories and I took interviews of over 63 patients, and many times these interviews last 2 to 3 hours. And when I did my analysis, I listened for the themes that emerged in each one of these interviews. And I discovered something very powerful. People who used art usually went to a place where they began with their suffering. They began with their story of their challenge and of their pain. So as if they began with the pain and darkness, and they shared their story where it began. And then the next thing they did when they started making art, they shifted into a different place of going somewhere else when they began to engage in the creative process itself. One of the participants in the study, who had pancreatic cancer, would wake up in the middle of the night with tremendous pain, and she knew she was dying. But one of her favorite things to do is she would turn on the light and she would return to writing her novel. And suddenly in writing her novel, her words was, I would go somewhere else. I would suddenly be in my book, in my story. I would become the characters I was writing about. I would see through the eyes of my character, and I was somewhere so different. So I was able to move from where I was, my suffering, my fear of death, into a place where I was creative and my novel was coming through me. Another thing they talked about was in the creative process, there was a turning point where they became so immersed in the flow of their creativity that suddenly there was a moment of transformation where they went from where they were, their old story, and to where they created a new expression of themselves. And they called this the turning point. And when they hit the turning point, they would describe this experience, and this is another phrase that someone used, called slipping through the veil, where they slipped inside themselves and they were able to tap into a place they had never known before, a place of their own creativity, where it's as if the poem began to write itself, or the painting began to paint itself, or the dance, their body began to move within itself. There was a moment in which they moved into their creative process, and the creative process took over. And this allowed them to be free and liberated. The other thing that they talked about through the creative process is that when they got to that point where they were in the full expression of their creativity, they described that process and that moment as knowing it was the truth and witnessing themselves. And they're able to see themselves in a totally new way. And they knew that this was the truth of who they were. And they were able to name it, they were able to see it, they were able to discover a new perspective of themselves. And it was as if in that moment they saw themselves in a brand new way, in a way they had never seen themselves before. The other thing that was really powerful in the stories, they began to talk about spiritual experiences, where they actually connected to the innermost essence of who they were. And many times this led them to a place of faith, led them to a place in which they prayed, or they identified that they were being held in God's hands, or they saw angels, or they experienced a moment of a spiritual opening where they felt their spirit expanded. And this was something I didn't realize was possible in the creative moment. I sort of felt it in my own journey, but they articulated it beautifully through the interviews. And the other thing they said, that was a theme that emerged, was feeling energy and feeling compassion. And that was really powerful. Self-compassion and feeling a flow of energy through their creative process which I thought was really remarkable and powerful. And the last theme that emerged was transcendence, because what I heard in the stories, which were very beautiful, were these moments where there was a moment of enlightenment or illumination or something that brilliant emerged in themselves, where they saw themselves or experienced something in a totally different way. Now, I did this research many, many years ago, and what I would say today, they moved in a place of transpersonal knowing, where they knew something within themselves, but they knew something that was connected to a greater presence than just themselves. And Dr. Jean Watson would say that that's when we move out of ourselves into the unitary field of consciousness, a place where we're all connected to each other and to a greater energy and presence than just ourselves alone. Caring science provides a theoretical model where we can understand this work much more deeply. And I'm very excited to share that with you, because I think when we use art as a way of healing, we are talking about creating a moment of caring, a moment of personal realization of caring for ourselves, a moment in where we can witness another human being in their authenticity, in their true essence, and we are related to them in that moment, and a caring moment emerges. Dr. Jean Watson says the theory resides in that moment, in that caring moment. And when we use art as a way of expressing ourselves, I have come to realize that art allows us to make that moment visible, make that moment felt, make that moment realized. And that is very powerful. And that, I think, allows us as nurses to use the arts as a way to not only heal the body, the emotions, the mind, but how can we allow the spirit to have a release of its own personal healing? When we practice nursing, the outcome is not always curing the patient, but the outcome should always be caring for the patient. So when we use art as a way of healing, we are tapping into transpersonal nursing. And when we are practicing transpersonal nursing, we are operating from a way of being. We are operating from a way of being an artist ourselves. And I'd like to invite you to tap into your own creativity as a beginning place. I would like to share with you now in closure that I have created a course called Healing with the Arts. It's a 6-module course on Coursera. It's on the University of Florida platform, and it's offered for free for students and participants all over the world. At this point, I'm proud to say there's over 20,000 students enrolled in that course. I invite you to take advantage of this and look at this course and look at some of the modules that might resonate with you, whether it's poetry, dance, movement, music, visual arts, so you can begin to explore your own personal journey of becoming an artist and tapping into your creative life. The way you can reach this course is you can Google Healing with the Arts, and it will take you to my website, and you can sign up through my website, and it'll take you directly to the link on Coursera. Also, if you register through my website, I'm creating a Facebook page where you can post your own projects, your own journal entries, anything that you want to share about your creative process with a whole group of people who are also engaged in that course. I want that course to be a resource and an inspiration for you to explore your own inner healing. So in conclusion, I am Mary Rockwood Lane, and I am honored for your presence and that we've had this time together. And I invite you to look at my website, Healing with the Arts, and reclaim the artistry of nursing within your own practice. Thank you very much.